Hantavirus is an emerging zoonotic disease transmitted by rodents,
including mice and rats.
The causal agent belongs to
The genus Hantavirus.
family Bunabiridae.
Its name comes from the Hansan River in southern Korea, near which the prototypical member. The Hansan virus was originally isolated in 1978.
The most common clinical form in the region is Hantavirus pulmonary syndrome, also known as HPS,
which can lead to death.
The incubation period time varies from a few days to almost 6 weeks after exposure. Infected people may experience
headache, dizziness, chills, fever, and myalgia.
They may also experience gastrointestinal symptoms,
including nausea, vomiting, abdominal pain, and diarrhea,
followed by a sudden onset of
respiratory distress, and hypotension.
Early identification and prompt medical attention improve the clinical outcome. Care during the initial stages of this disease should include
antipyretics and pain relievers as needed.
In some situations, patients should receive a broad-spectrum antibiotic while confirming the etiologic agent. Given the rapid progression of HPS, clinical management should focus on
patient hemodynamic monitoring, fluid management, and ventilation support.
Serious cases should be immediately transferred to
intensive care units, also known as ICU. Mortality rates can decrease considerably thanks to early diagnosis and the presence of decentralized laboratories that facilitate early detection and better case management.
Although there have been substantial vaccines,
there is no licensed vaccine against hantavirus infection that can be widely used.
It can be prevented by reducing people contact with
rodents and excreta,
in combination with
environmental hygiene practices that prevent rodents from colonizing the home and places of recreation and work.
Attempt to reduce the presence of mice, and also try to not be in contact with their droppings, urine, and saliva. Here I can leave you some tips.
Storing food, water, and garbage in heavy plastic or metal containers with tight-fitting lids. Sealing any holes in structures where mice may enter. Cutting back thick brush and keep grass short. Keep wood piles away from the building. Using rubber or plastic gloves when cleaning up signs of rodents. Handling red rodents or other materials. When finished, clean gloves with soapy water before taking them off. Wash hands with soapy water again after removing the gloves. Setting traps when necessary. Put rodents in a plastic bag, seal the bag, and dispose.